Hi, I'm Abby, and I did my site visit through the Behavioral Health Services through Mary Lanning in Hastings, Nebraska. And I met with Kim Kern, and she's a licensed clinical social worker, and she is the director of both the inpatient and outpatient services for behavioral health. So, to cover the whole thing, it is the Behavioral Health Services through Mary Lanning. Um, so the population that they serve is obviously individuals who need mental health services. There's two different kind of clinics. So the outpatient clinic would be called the Lanning Center, and the population that they serve is our ages from their lowest age is 2 and then on. So they serve a wider population than the inpatient services, which is primarily adults. So they're 19 and above. Um, but both are behavioral health services or mental health services. So anyone wanting mental health services would be the population served. So the funding source, Kim reported that the primary funding source would be Medicare, followed by Medicaid, and then private insurance. Um, and then there's a sliding scale through the Region 3 contract as well. So with that being said, there's differences on the sliding scales for each of the clinics. So the inpatient on the floor, you would have to be EPC'd and you would be at a certain income guideline to get the sliding scale. But if you come in voluntarily, you would not, which would not be EPC'd or emergency protective custody. That's what EPC stands for. But if you do not get EPC'd, then you would have the sliding scale would not apply to you. But then for the outpatient services at the Lanning Center, all of their services are offered on a sliding scale for people who don't have insurance, or if their insurance coverage or doesn't quite cover that. And just to let you know, to get EPC'd, it would be if you are a danger to yourself or other people, or mentally ill. That's how you would get EPC'd for the inpatient services. Okay, so some of the policies changes. She talked about the biggest thing that they kind of struggle with was that there has not been a rate increase in Medicaid for behavioral health services in 2 years, which is a long time. And Kim was nice enough to give me information on this, and it's through NABHO, the Nebraska Association of Behavioral Health Organization. So they look at different things, and this shows a trend of what inflation would be and what they are currently get through the Medicaid. So I can post this if you want, or I can put a link above or below, wherever in this video, wherever this video goes, so that I can show just how different the reimbursement rates are and how inflation is increasing, but behavioral health, the money towards behavioral health is not increased. So that's kind of the biggest thing that biggest challenge that they are working towards. And they are also looking at rate cuts instead of increasing the rate for behavioral health right now. So the biggest challenge is losing money and not keeping up with the costs already. So also we talked about the Medicaid expansion and how Medicaid expansion would affect their business. So Initiative 427, or Medicaid expansion, which I'm sure many of you are aware of, would be something very beneficial for them because, so say if someone does come gets, well, they wouldn't be EPC because then there would be the sliding scale, but if they want to come voluntarily to the inpatient and they can't afford it because, say, they make too much money to be on Medicaid, then the hospital, a lot of the times those individuals might go into bankruptcy, and the hospital would just kind of eat the cost then. So this would help them stay, it would keep them from losing as much money if a client would have insurance. So this would be helpful for not only the person who, the client who might have to go bankrupt to be able to afford services, but it would also be helpful for the hospital in gaining money that they wouldn't get before because their client would be on an insurance plan. It would also bring more, it would bring more money to Nebraska because 90% would be paid by the federal government and then 10% would be paid by the state. So with that, we would gain more money for the economy, and so Medicaid expansion would also cover over 90,000 Nebraskans. And I'm sure you guys have probably been aware, it's kind of a buzzword right now, Medicaid expansion. So I'm sure a lot of you are already aware of some of the benefits of Medicaid expansion. Another thing that she talked about, which was really great, was Beacon. So it's the Behavioral Health Education Center of Nebraska. They offer loan forgiveness plans. So this is something this is a policy change that has been good. So they offer loan forgiveness plans for psychiatric nurses or any mental health profession who need to do a rotation. So they do a month rotation on their second year, and if they do it in a rural area, they can get loan forgiveness. And what has been really good is that these people might come back because they like working in the rural area. They get that experience in the rural area. And then we have more people that can offer behavioral health services. Another thing she talked about was Legislature Bill 964, which before only law enforcement could do an EPC. But with Legislature Bill 964, a mental health professional can enforce an EPC. So this would help with the clients. They would understand, the clients would feel more, what's the best word? Law enforcement don't necessarily always have training in mental health, so having mental health professionals be able to offer that service would be beneficial to the client, and it'd be beneficial for mental health professionals. So overall, my site visit, I hope I touched on enough of those. So overall, the biggest thing for them has been that there hasn't been a change. There hasn't been a budget increase in the last 2 years. So that's been the biggest thing. They keep on saying they don't want to spend any more money on behavioral health, the state. So with that has caused a lot of challenges, but they've also looked at different ways to kind of help with that, like the loan forgiveness programs, Medicaid expansion, possibly in the future. And then also I wanted to talk about what can be done to address this. NABHO, the Nebraska Association of Behavioral Health Organization, does a really good job of creating educational opportunities and legislature opportunities for people to learn more about what kind of bills might affect mental health. And then overall, I'm getting long on time. Overall, my visit was really great. I really liked meeting with Kim. It was really nice being able to see the big picture of things. And because I do already work in mental health, it was so good to kind of connect the dots in areas where I wasn't really sure about things. And so it was really good to talk to someone who knows more about legislature bills and the full picture, and then to look at how the full picture affects just the day-to-day things. So I hope I learned a lot too. I learned a lot. And I actually did another one at Community Health Center too, but a site visit at Community Health Center. But overall, I learned a lot, and I hope you guys learned a lot with this video too. But we're getting close on 10 minutes, so bye.